All right. Without further ado, so let me start by introducing myself. I'm David Relman. I'm chair of the Forum on Microbial Threats. I want to welcome all of you to this workshop. We are delighted to see this come together in such a splendid manner. We're delighted to have such a great audience here, and excited about addressing a topic that is a topic we have, many of us, all of us have grappled with personally and professionally for quite some time. We're hopeful that this meeting will provide even greater clarity and direction and purpose to what is a very difficult set of problems. So let me just start by thanking a few people. I want to thank our organizing committee, first of all, led by Lonnie King, and Lonnie will have a chance to make some comments shortly. I want to thank all of the others who have contributed to the planning of this meeting. There are many of you here. I also want to thank all of the speakers now for having made a journey that I understand was trying and taxing for some of you. A few others will join us electronically only because they were prevented from being here in person by some of the other forces of nature. I also want to thank our staff who have done an incredible job in helping to conceive and then bring to fruition this meeting and all of the activities surrounding it. So thank you all for that. I mentioned that antimicrobial resistance is a problem that this forum has thought long and hard about for quite some time. Most recently, in 2010, we held a workshop and produced a report addressing many of the issues that we will return to here in the next 2 days. These problems, of course, have not gone away, but as you will hear, there may be some opportunities now to have a chance to make some important points and have them heard by folks who are now beginning to assume responsibilities around the world that offer the possibility of some action that we hope will be undertaken. So without further ado, I think I will introduce the person who will get us started here this morning. It's a very appropriate person. He is Victor DZAU. Victor, as you all know, is president of the National Academy of Medicine. He is also the Chancellor Emeritus and James B. Duke Professor of Medicine at Duke University. Victor has been a tireless advocate for public health governance, for innovation in thinking and organization and planning around these big intractable problems. He led a big effort 2 years ago and last year that involved this forum in helping think through some of the problems needed to improve governance of global public health. And we're delighted that he's here today to join us for opening this workshop. So thank you, Victor.
Thank you, David. Good morning to all of you. Good morning. All right, thank you. David, Lonnie, and Jim, thank you so much for putting this workshop together. Thank all of you for being here. A very important workshop on combating antimicrobial resistance, One Health approach. First of all, I want to begin to thank the Forum on Microbial Threats and the staff who put this together. Tremendous effort, and you can see the turnout today. Particularly a shout out for C.C. Mandaka, Shah, Ayano Ogawa, and also Antron. And I've worked with them before, and I continue to work with them, and they're the best. So thank you very much. And also, of course, to Lonnie King, who's the Workshop Planning Committee Chair. A round of applause for them. Now, how to get thanked before the meeting. So if the meeting succeeds, we thank you again. If it fails, we forget this one. Importantly, of course, that we know this is such an important topic. AMR has been on the rise, and there are very few prospects of new antibiotics in the pipeline. You all know this well because this is a learned audience. More than 700,000 people die of resistant infections across the world every year. And many of you know the famous O'Neill report that by 2050, it's estimated that the rise of drug-resistant infection could cost 10 million lives a year and a cumulative $100 trillion of economic output if the status quo continues. Very, very important and sobering statistics. Now, so we know that the rise of AMR really, we are at risk for unraveling decades of progress in health and medicine. And without effective antibiotics, those untreatable infections or routine medical procedures will become life-threatening. So we do know that effective antimicrobial drugs are prerequisite for both preventive and curative measures, but yet the misuse and the overuse of these drugs in human, in food production, in livestock, you're going to hear about One Health today, have put every nation at risk of devastation in human lives and economic loss. But it's not only a public health issue, it is also a national and global security issue. If you look at resistant bacteria, they don't respect national borders and threaten countries at all different levels. So we have to address this issue. Very simple example. Many of you know that the New Delhi metallo-beta-lactamase enzyme that enables bacteria to survive broad range of beta-lactam antibiotics, the carbimazepines, one of the last line agents, was found first time in India in 2008, but by 2010 is discovered in Sweden, UK, and Canada. Likewise, it's not only coming from, say, countries such as Asia and others, but also in US, a unrelated enzyme-related resistance was identified US in 2000, and by 2005, it spread to Israel, several European countries, and Colombia. So if these are not cause of concern enough, just imagine the emergence of a rapidly spreading bacteria resistant to all known antibiotics. That would be just devastating, you can imagine. So this is, in fact, the urgency of the issue. We need to act now, or else we run the risk of entering a post-antibiotic era. So fortunately, many people in this room and leaders are working on it, leading and paying attention to this. Certainly, I say the world is starting to take the threat of AMR seriously. For example, UK, Dame Sally Davis here, was one of the first countries to respond to a growing AMR threat with the introduction of the 2000 AMR Strategy and Action Plan, followed by a further strategy in 2013. Here in US, under former President Obama's leadership in 2014, he signed an executive order and released a national strategy on combating AMR. And in 2015, released a national action plan that also led to the formation of CARB-X, as you know, in 2016. And certainly, international multilateral organizations are also recognizing the threat, ranging from WHO, WHA, G8 Science Academy, and of course, most of you know, all of you know, 2015, G7, under the leadership of Chancellor Merkel, made AMR a key priority. This was affirmed by Prime Minister Abe in G7 in 2016. And I think probably the greatest recognition as a priority is the UN General Assembly. And I'm sure we're going to hear from Sally Davis and others on this issue of the political declaration of AMR in 2016. The 71st session of General Assembly on September 21st, 2016, all 193 member states signed on to a political declaration which calls for a collaborative, multi-sectorial approach to addressing AMR. So these are all very good first steps, but we all know a lot more has to be done. We now need to act. We need to move from statements to action and fully implement what's outlined in UN General Assembly's declaration and countless other assessments. However, we all know only little more than half of the member states have completed, about to complete their national plans on AMR. Long way to go. Now, where do we come in here today? Well, as you know, the National Academies have a long history working this area with the forum, as you heard from David Relman, already tackled this issue in 1988. There was a workshop called AMR, Issues and Options, and then in 2010, the forum discussed implications of antibiotic resistance for global health and novel intervention strategies. In 2011, it looked at emerging fungal disease and resistance to antifungals. We need a One Health approach, and it's difficult to imagine an issue that epitomizes the principles of One Health more than AMR does. One Health approach will recognize the health of people is connected to health of animals and the environment, and AMR has clear links to each of these three domains. So, despite the recognition that One Health approach is necessary to tackle this problem, there's still a lot of knowledge gaps and complexities that need to be addressed in order to foster collaboration and cross-sector and discipline, which is the purpose of this workshop. We have gathered so many of you from many different sectors, discipline in this room, in order to see how we can all move this issue forward. Importantly, we need to identify concrete ways that we can move from knowledge to action. With decades of progress and millions of lives at stake, combined with widespread recognition, AMR is a serious global threat among political leaders. It's time to act. So a key focus of this workshop is to explore immediate and short-term actions and research needs that will have the greatest impact reducing AMR. Purpose of our final session is to answer the question, what are the top three intermediate or short-term actions within each theme that could result in biggest impact that is feasible and cost-effective? So I'm really glad that I have the chance to talk to all of you and to see the enthusiasm in this room and this meeting. And I'm hopeful that dialogue and debate over the next 2 days will lead to actual progress in conquering AMR. Again, thank you very much for joining us. Thank you. So we have lined up for you two outstanding keynote speakers, and I know that they bring a lot of their own experience and their tremendous drive and passion in this area, and I do look forward to hearing what they have to say. And first, I'd like to introduce Keiji Fukuda. He's our first keynote, followed by Dame Sally Davis. Keiji Fukuda is Director and Clinical Professor at University of Hong Kong School of Public Health. He previously worked at WHO in several capacities, including Assistant Director General and Special Representative of Director General for Antimicrobial Resistance. He was ADG for Health Security and Environment Cluster, Director of Global Influenza Program, and before that, he worked at US CDC as Epidemiology Section Chief, Influenza Branch. KG has been a global public health leader in so many areas: health security, emerging infections, food safety, and chronic fatigue syndrome. And obviously, this is an area of his great expertise. And please help me welcome Keiji Fukuda. Thank you.